Welcome to Medicare 101, offered by the Office for the Aging of Steuben County. Before we start talking about the different parts of Medicare, it is important to know that you might have to actively enroll in Medicare if you aren't already receiving Social Security income. To do this, you should contact the Social Security office at least 3 to 4 months prior to turning 65 so they can process your Medicare enrollment in a timely manner and give you time to plan for your insurance needs. The Medicare insurance card will look like this once you receive it. The following are the learning objectives for this training: Medicare Part A, Hospital; Medicare Part B, Medical; Medicare Part D, Prescription Plans, Supplemental or Medigap Plans, Medicare Advantage Plans, Epic, and the coordination of benefits. The chart that we will reveal on this slide is the visual structure that we will use throughout this training to illustrate the different parts of Medicare and the options you have under Medicare. Original Medicare includes Part A, Hospital, and Part B, Medical. In order to have prescription coverage, you may need to add a Part D prescription insurance if you have no other creditable coverage. Some may also have to add a supplemental or Medigap insurance to cover the extra costs associated with original Medicare. Or the alternative is enrolling in a Medicare Advantage plan that covers Part A, Hospital, Part B, Medical, and usually Part D prescriptions. We will go into detail on the differences between these choices during this training. The last part of this illustration is Epic. Epic is the secondary prescription drug coverage that is only offered in New York, and it can help to reduce copays for prescription drugs. First, we will discuss the parts of original Medicare, and we will start with Part A, Hospital coverage. Part A, Hospital coverage under original Medicare is the free part of Medicare for most people that have worked at least 10 years and contributed to Medicare. This coverage includes inpatient hospital care. There is a deductible required for each benefit period that someone needs inpatient care, and also a per day charge if the stay is longer than 60 days. Some individuals require skilled nursing care after an inpatient stay, and Part A covers the first 20 days of this care if you start skilled nursing care within 30 days of a discharge from the inpatient hospital stay. If the skilled nursing care is longer than 20 days, there is a per day charge for each day up to 100 days. Original Medicare Part A covers some limited home health care coverage, and it also covers hospice care, depending on what stage of life you may be in. Let's go over a case study regarding the requirements of Part A in relation to skilled nursing facility coverage. Patricia was admitted to the hospital as an inpatient on March 3rd after falling in her home and injuring her hip. She was discharged on March 8th and felt ready to go home at that time. After over a month at home, she began to have some pain in her hip. She spoke with a doctor who said she should go to a skilled nursing facility for daily rehab care. She is admitted the next day. Will Medicare cover Patricia's skilled nursing facility care? Yes or no? No, Patricia meets the 3-day qualifying hospital stay requirement, but because she entered the skilled nursing facility more than 30 days after her discharge, Medicare will not cover the skilled nursing facility stay. Next, we will discuss the original Medicare Part B medical coverage. Part B of original Medicare is the medical coverage of Medicare and has a monthly premium that is established each year. If your annual income is above a certain threshold, you may pay more than the standard Part B premium. There is an annual deductible that needs to be met each year before original Medicare will pay the coinsurances on each of the designated areas. Once the deductible is met, Medicare will generally pay 80% coinsurance in the following areas: doctor's visits, outpatient hospital care, lab services, x-rays, diabetic supplies, durable medical equipment, physical therapy, ambulance, chiropractic, and outpatient mental health. If you fail to enroll in Part B Medicare when you are first eligible, there is a penalty for every 12-month period you are without Part B coverage, unless you have coverage through current employment. If someone decides to stay with original Medicare, it is important to know that there are many excluded services that you may need to plan for outside of original Medicare coverage. The Advantage plans may cover a portion of these excluded services, which we will discuss later in this training. Next, we will discuss Part D prescription drug coverage. Original Medicare Part A and Part B do not cover outpatient prescriptions that your doctor prescribes. So those who stay with original Medicare may need to add Part D prescription coverage if they don't have any other creditable coverage. Unlike original Medicare, Part D coverage must be purchased through an insurance company. These plans have monthly premiums that are determined by the insurance company. Each plan will have its own deductibles, coinsurances, and copayments based on a drug tier system for each of your prescriptions. The formulary will tell you what specific prescriptions are on that insurance's list of covered drugs. Part of the decision-making process in finding a plan that works for you is making sure that all of your prescriptions are on the formulary for that insurance. Over-the-counter medications are generally not covered by these prescription plans unless they are prescribed in a manner approved by the FDA and for a specific condition. If you do not sign up for a Part D plan when you are first eligible, there is a penalty for every month that you do not have creditable coverage. Creditable coverage is coverage that is just as good as Medicare Part D plan or better, and can be through current employment insurance or retiree insurance. There are two different ways to get Part D coverage: a standalone Part D plan or a Part D plan that is included in a Medicare Advantage plan. Let's look at a case study regarding over-the-counter medications used for a specific condition other than its primary use. May has a standalone Part D plan. Her doctor writes a prescription for a cough drug that will alleviate bronchospasms from her severe asthma. The cough drug is approved by the FDA to treat severe asthma, though it is typically used for cough and cold symptoms. Will May's standalone Part D plan cover this cough drug, assuming it's on the formulary? Yes or no? Part D will cover this cough medication because it is being prescribed for something other than cough and cold symptoms, and it has been FDA approved to do so. If the drug were only being prescribed to treat cold and cough symptoms, Part D would not cover it. Drug tiers are a way for prescription drug plans to price the copay for the drugs listed on their formulary. The lower the drug tier, the less you pay. Here is a sample tiering structure. When you choose a plan, you will want to search through the plans to find one that covers all of your medications and has them categorized on the lowest tiers, so your cost is lower. The Medicare Plan Finder helps simplify that process when choosing a plan. There are phases in your drug coverage under Medicare that you should be aware of. Each plan will have a set deductible that needs to be met at the beginning of each year. Once you have met the deductible, your drug costs will be based on the set copay in your plan, which is called the initial period. Each year, Medicare sets the threshold at which you enter the coverage gap or donut hole. This is a special pricing category where you have to pay a certain percentage of the drugs. Once you reach the next level of out-of-pocket costs for your drugs, there is a catastrophic phase for the rest of your plan year where you will have minimal copays. Here are some tips to keep in mind that will help you to stay out of the donut hole and keep your costs lower. Work with your physician's office to get a prescription that is on your formulary. Switch to a generic form of drug. Ask for samples. And if you're starting a new prescription and samples aren't available, fill a small amount to make sure you can tolerate the medication. Later in this training, we will also talk about a plan called Epic that can also help with this. Next, we will discuss adding a supplemental or Medigap insurance that will help control the extra costs associated with original Medicare. Supplemental plans have established monthly premiums that are determined by each insurance agency that carries this type of plan. These plans are always a secondary insurance to original Medicare, and each lettered plan is standardized, and you can pick a plan based on what level of coverage you would like to have. You must have a standalone Part D plan unless you have other creditable coverage like a VA prescription plan. Let's review this case study that highlights the order in which claims are billed when you have a supplemental or Medigap insurance plan in place. Maria has original Medicare and a Medigap. She goes to a nearby outpatient clinic for a medically necessary chest x-ray. How does Maria's Medigap policy work with Original Medicare to cover the cost of her X-ray? Will the Medigap pay first or Original Medicare? After the Part B deductible is met, first Original Medicare will pay 80% of the Medicare approved amount for this service. Maria's Medigap will pay second for some or all of the remaining 20%. This chart identifies most of the plans to choose from and what coverage level they provide. Plan C and F are grandfathered plans that are only available to those eligible for Medicare prior to 2020. This chart identifies the known premiums for each plan according to what insurance company you purchased the plan through. It's important to pick an insurance company that your doctor accepts for it to work for you as a secondary insurance. Even though these costs seem to be high for a monthly premium, it is a predictable cost that will give you peace of mind regarding the unpredictable cost sharing of Original Medicare. The alternative to the coverage options we just explained is the Medicare Advantage plans, and this would become your primary insurance should you choose this method of covering your insurance needs. Medicare Advantage plans are a way to cover Part A, Part B, and usually Part D all under one plan. These plans are managed by insurance companies, much like the standalone Part D plans. There can be extra benefits that are not covered under Original Medicare, like dental cleanings, vision exams, and glasses. Generally, there are networks of providers that will accept each plan, so it's important to check with your physician to ensure that they will be in network with your insurance plan so you can have the lowest copays for services. Sometimes referrals can be required, and each plan is organized differently, so they are far from standardized plans. The Medicare Plan Finder is a good tool to sort through all of the plans in your area and pick the best plan for your individualized needs. These plans organize the cost sharing of Medicare insurance coverage in a different way than Original Medicare, but have to cover the same essential services that Original Medicare covers. Each plan will have a premium, but many have zero premium because Medicare uses your Part B premium from Original Medicare and pays whatever insurance company you pick to manage your care, so no extra premium may be necessary. Each plan will designate deductibles, copays, and coinsurances for each category. The one thing that Original Medicare does not have, and Advantage plans do, is maximum out-of-pocket limits. That is a set amount for each plan, and it's a boundary or safety net for beneficiaries in the case of a catastrophic occurrence. It is important to evaluate the type of Medicare Advantage plan that you pick, as well as whether your physician is in network with the insurance company. HMO plans are plans with strict networks that do not cover out-of-network costs. You need to choose a primary care physician to manage your care and may need referrals to see a specialist. Private fee-for-service insurances have fewer restrictions, but most people pick PPO plans for the flexibility of in and out-of-network coverage. If you travel to different states during the year, Advantage plans may be more limiting than if you were with Original Medicare, with its freedom to provide coverage anywhere in the U.S. The following are some things to consider as you evaluate which Medicare options would work best for your situation. Providers, hospitals, and other facilities. Is my doctor in-network or out-of-network for this plan? If my providers aren't in-network, will this plan still cover my visit? If I travel, will the insurance cover in other areas? Costs. Premiums, deductibles, co-payments, maximum out-of-pocket. Prescription drugs. How well does this plan cover my prescriptions? Is my pharmacy a preferred provider with this plan or just standard? Extra benefits. Does this plan cover extra services that Original Medicare does not, like dental, vision, hearing, transportation to medical appointments, or gym memberships? Let's look at a case study that shows an example of the coverage difference between Original Medicare and the Medicare Advantage plans. Kimiko is approaching 65 and faces a choice of healthcare coverage. She lives in Nebraska, has a second home in California, and visits her adult children in Illinois, Massachusetts, and Florida throughout the year. How might Kimiko want to receive her Medicare benefits so that she can receive covered services throughout the country? Original Medicare or Medicare Advantage? Original Medicare will provide Kimiko with the freedom to receive covered services anywhere in the U.S. The last optional insurance we will cover in this training is a secondary drug insurance that is only offered in New York State called EPIC. EPIC insurance is either covered with a premium or a deductible, depending on your level of income. You must be at least 65 years old or older to apply, a New York resident for at least 6 months out of the year, and you have to be below a certain income, depending on whether you are single or married. EPIC also gives you a chance each year to make a change to your insurance outside of an open enrollment time frame. EPIC may cover prescription strength vitamins and other items not covered by your formulary. This last topic is called coordination of benefits, and your decision about Medicare coverage may be different depending on what other insurance you have prior to joining Medicare. In some cases, you may not pick up certain parts of Medicare because it is covered by another source, like prescription coverage through the VA. Retiree insurance through your work may take the place of selecting a Medigap, but most of the time you still have to enroll in Parts A and B of Original Medicare. TRICARE plans require certain parts of Medicare to be in place to continue their insurance, but it acts as a secondary insurance to Medicare. Federal insurance is a category all by itself because it doesn't require one to even be enrolled in Medicare if staying with federal insurance is your goal for the long term, but it can come with some penalties if you ever decide later to enroll in Medicare. COBRA insurance is a continuation of work insurance, but it is not considered creditable coverage if you are considering delaying your Part B coverage. But insurance coverage through current employment could be considered creditable coverage and allows you to delay enrolling in Part B Medicare for as long as you are covered by this insurance through current employment. All of these different scenarios are complex, and understanding the decisions you need to make for your insurance needs and complying with the requirements of Medicare can be a daunting task. But here at the Office for the Aging, we are committed to walking you through the decision-making process so you can have a targeted plan of action to be confident in your next steps into the world of Medicare. There are other programs that may also help pay for Medicare costs, depending on your income and other circumstances. The following are contact numbers or resources that you can use to seek additional help. Now that you have completed this course, we encourage you to reach out to the Office for the Aging for further assistance in these areas or to clarify any questions you may have in this journey into Medicare. We also encourage you to watch our video on setting up your Medicare.gov account and entering your medication list into your account. This is a helpful tool to simplify the insurance decision-making process and allows you to use the plan finder to narrow down your options. Thank you for watching our Medicare 101 video training, and we hope to hear from you if you need assistance in fine-tuning your Medicare insurance strategy.